the crowd and plays so loud, baby, it's the guitar man.
Welcome back into the Ask Dr. Rick Show on 590 Demand, KFNS at 590demand.com. As always, the show is brought to you by Gateway Buick GMC at I-270 McDonald Boulevard. I'm Mark Zinn, alongside the legend, again, Dr. Rick Lehman.
Mark, how are you? We have you're the weatherman. Got a little inclement weather this week.
Well, not inclement, but yeah, it's been a little bit like Seattle, but hopefully nothing like, well, I'm sure it's pretty nice down there right now in New Orleans, and that's where our next guest is calling us from. Dr. Donald Palmisano. He's the former president of the American Medical Association, and he's an author of the books On Leadership and the Little Red Book of Leadership Lessons. And God knowing, Dr. Rick and I need a little bit of some leadership lessons. Dr. Palmisano, thanks for coming on the Ask Dr. Rick Show.
Well, it's a pleasure to be with you. And the weather, it's light rain. I was teaching at Tulane Med School today. I teach a course, Leadership in Medicine. And on the way home, had some rain, but it's fine. No adverse weather other than that.
Well, that's good to hear. You're the clinical professor of surgery and the clinical professor of medical
jurisprudence. That's correct. At Tulane, I teach a course, Leadership in Medicine, and they use me for some other things, lectures and grand rounds on occasions. Yes.
Well,
that's awesome.
That is awesome, and we're pleased to have you on to talk a little bit about the Affordable Care Act, also known as Obamacare. You were the American Medical Association president, I guess, before all this took place. And
Correct.
Then after that, the American Medical Association and the powers that be supported this legislation. So I guess to start the conversation off, why do you think that was a bad decision for the AMA to support Obamacare?
Well, as I expressed to the AMA and to anyone else who would listen on radio shows, TV shows, and in op-ed pieces that I wrote, to me, and this is my opinion, I'm not speaking for anybody else, I'm speaking for myself right now, this goes against what AMA has in its policy. What we want is less government control at AMA. What we want is the right of the patient to have privacy, medical record confidentiality. All of that is very strong policy. Health savings accounts are very important, and the right to buy across state lines. All of these things. When I was president, I wrote articles about that. I had the privilege as president of the AMA to travel to meet with other country presidents in June 2003 at the meeting of the British Medical Association. The chairman of the British Medical Association, Dr. Bogle, characterized his nation's single-pass system as the stifling of innovation by excessive, intrusive audit, the shackling of doctors by prescribing guidelines, referral guidelines, and protocols, the suffocation of professional responsibility by target setting production line values that leave little room for the professional judgment of individual doctors or the needs of the individual patients. That's from a Journal of the American Medical Association letter that I wrote. I just read that, and I've seen that in other countries where you end up with long lines and you don't end up saving money. I had the privilege in 1976 to represent the doctors in Louisiana. I testified before the Health Subcommittee of Ways and Means. Mr. Roskantowski was the chair of that subcommittee, and I spoke on behalf of the doctors against government involvement. It always costs more, and it ends up making less choices for the doctor. In the current law that just passed, first it was passed with a lot of misinformation, this business about being able to keep your doctor, keep your health plan. Now that's all turning out to be, oh, no, I didn't mean exactly that. That's providing it fits in with our guidelines, what we want, and so on. So those are problems. When here's one from President Obama. I have this in my new book. He's at a health town hall meeting in New Hampshire on August the 11th, 2009, as seen on CNN. He says, right now, if a same diabetic ends up getting their foot amputating, that's $30,000 to $40,000 to $50,000 immediately, the surgeon is reimbursed. And I was shocked to hear that. And the American College of Surgeons, fortunately, sent out a press release the next day, August the 12th, and posted it on their website. And he pointed out that surgeons get $740 to $1,140 for a leg amputation if it's a Medicare patient. And it includes 90 days of care for the patient. And then they go on about doing tonsillectomies for the money and so on. And they said that remark was ill-informed and dangerous, and we were dismayed by this characterization of the work surgeons do. Surgeons make decisions about recommending operations based on what's right for the patient. So there's so much misinformation that occurred when this law was passed. Very few people understood it. I mean, the Speaker of the House is saying we'll have to pass it so we can find out what's in it away from the fog of this controversy. That's a bad way to do lawmaking. And right now, what's going to happen, not only are people having a gigantic problem with this website for the health care law, but what's going to happen is your doctor, even if you're able to get insurance that you say, well, this is okay as far as the coverage, your doctor may no longer be on that particular panel, and so on. You won't have the same doctor you've had, and thousands of stories are coming in around the nation. You'll hear it on radio, you see it on TV. You may have already done stories on this, but it's just a bad law. What the alternative, what we wrote in the Wall Street Journal, myself and two other former presidents of the AMA, is a system whereby the patient is in control with the doctor's trusted advisor. The patient can buy across state lines where there's real competition. The patient owns the policy, so there's no job loss. Health savings accounts are encouraged. All of these different things will and help people who need help. For instance, putting more people on Medicaid, that is essentially a sham because having an insurance card does not guarantee you're going to find a doctor. And there are many doctors who no longer take Medicaid. Why is that? Because the cost of delivering the care is less than the reimbursement or the fee given by the government. A better system is what they do in Australia. I lectured over in Australia on my book on leadership in 2008. And what they taught me was they have a Medicare program, and so you could call it Medicare, Medicaid, whatever you want to call it, but they have a government program. However, the government decides what they're going to pay, and they let doctors and patients privately contract for the remainder. So now you got competition in the mix. You'll have doctors, one doctor wants X number of dollars over, $5,000 over for that operation. Another one might want $500. That was a real story. One wanted $5,000 more, one only wanted $500. And both had excellent reputations, and the man I talked with over there, a prominent executive, he went with the $500 over the government payment, got a great result for total knee replacement. So we're losing competition, and every time the bureaucrats get involved, the first patient they treat, by the way, will be the next patient they treat will be the first patient they treat. And so this is a bunch of imagination on their part. I love Louis. What Huxley said, Aldous Huxley, facts don't cease to exist because they're ignored. And a lot of facts are coming out now, and I don't see how the people in Congress can ignore these facts. And I love what these facts. And then Louis Pasteur said, and I wrote that in my article, I did an op-ed in 2010 where I said the 2010 Patient Protection and Affordable Care Act gets a failing grade, and I explained the reasons why. But what Louis Pasteur said, imagination should give wing to our thoughts, but we always need decisive experimental proof. So Congress ignored those words of wisdom and gave America a system doomed to failure. I mean, think about the privacy and confidentiality. You putting information, your Social Security number, and they have not tested this thing from the beginning to the end to make sure all this works. There's going to be all sorts of fraud taking place. It's just a mess,
Well, no, I think that's right. This is Rick Lehman. I'm an orthopedic surgeon, a sports guy in St. Louis. And I think the other thing that I'm hearing, well, two things. One is when this Obamacare situation was announced, Washington University, Barnes Jewish Hospital, big hospital in St. Louis, first thing they came out and said, we're not taking any exchanges, anybody on Obamacare, we're not interested. The second thing you hear at all the sports meetings, and I would have to be in that line or in that camp, would be, we're not going to take it. I mean, we're backed up for 6 months for surgery, so why would I, work 4 times as hard to take something and then have the government in my computers and checking to make sure I got the right CPT code, et cetera. So I think the biggest thing you're going to see in St. Louis anyway is you're going to see very, very few physicians. So now you got 30 million new people that, voila, have this great health insurance. Unfortunately, it's like having a brand new car and every Jiffy Lube in the whole world is filled up for years and you can't get your oil changed. So no one is going to take these patients. Before, if they had a problem and they didn't have insurance and they went to St. Louis University or Wash U and they went to the emergency room, they got taken care of. They waited, they got taken care of, they went to free clinics, and there was a mechanism. Everyone said they don't have insurance, they didn't get health care, and that really wasn't correct. Now what you're doing is you're basically delegating these patients to people, And people are going to opt out. They can't force you to see these people. And what you're going to see now is fewer and fewer doctors who are going to want to take these people. And how you said it, how can you run your practice with the least amount of payment from each patient? Somewhere along the line, you have to get people that either have decent insurance or are going to pay you some cash, because you can't take the lowest rate, patient after patient after patient, Obamacare after Obamacare, and pay your staff and your EMR and your billing company. It just can't be.
Absolutely. You got it correct, Dr. Rick. Absolutely. And one time I was testifying to Congress. I had the privilege to testify on many occasions on different topics. But one time we were talking about health system reform, and I pointed out about Medicaid, and I said, they wanted to know, do you treat Medicaid patients? I said, yes, we're a group of 6 surgeons. Yes, we treat Medicaid patients. I treated some patients this week who were covered under Medicaid. I said, but let me point out something to you. I just called my surgical partner who monitors our practice and hires the individuals. He's like the office manager. And he reminded me that we don't send any bills for Medicaid. And I said, oh, we don't anymore? He said, no, we don't. I told that to the people in Congress. They said, well, what do you mean you don't send bills? I said, the reason we don't, first of all, Medicaid pays you less than the cost of delivering the care. And number 2, every time we would send the bill, they would reject it. So we hired a specialist to handle this one source of information to send to the Medicaid people. And they kept getting rejected. So finally we said, we don't need that extra employee. We'll just stop billing. Now I said, on the other hand, if you all spread the word through the reporters that we don't bill the government and you all send hundreds of Medicaid patients, then we soon won't have a practice anymore, because we have to pay our staff. And you can't make it up on volume if you lose on every patient.
Right. And I think you're going to have fewer people insured. I mean, this notion that all these young people that they're not dumb. They realize that they really have very low utilization in terms of their health care. So Mark Zinn, who's probably, he's not sick. He goes to the doctor very infrequently.
Great health.
He's great health, good looking. Why would he spend, at the highest platinum level to support Obamacare? It doesn't make any sense. Young people who are not, don't have a tremendous amount of income, extra income, etc., are not going to go take it and buy health insurance. What they're going to do is they're going to spend it on what they want to spend it on, and they realize that they're not having a problem, getting sick, number 1. And number 2, you're not going to get some young person to sit at a computer for 4 hours signing up for this. I mean, they're going to get 2 of those big red asterisk things, and they're going to be like, forget it. I'll go do something else.
Twitter.
So I just think that for them not to have the rollout just as smooth as silk and to have these glitches is just foreshadowing of the nightmare that we're about to get into. And you hit it on the head. You see a patient for Medicare, and I don't do Medicare or Medicaid. You see a patient, and you're just flipped out that the government's going to come in, and because of some change in how much you charge for an office visit, it might be $3, they're going to fine you $10,000 because this was not a detailed exam, it was some other kind of exam. And really, who wants to get into that?
Right, exactly. And people become frightened about that. When I talk to medical students, not only here in Louisiana, but in other parts of the nation when they invite me to speak, and that's their big concern right now. They're very uneasy about the future of medicine. They wonder if they've made the best choice. And I tell them, it's a wonderful profession. You will save many lives during your time, and it's great. You can save a baby's life. You can save a young man on a motorcycle with a ruptured spleen, and you are there and you save that person's life. It's a wonderful feeling. And so just don't give up. I tell my dad, and when I thought about quitting med school, my dad is a policeman, never went to college, but a very heroic guy, rescued people in hostage situations. And my dad said, son, you're smart enough to be a doctor, but you have to remember 3 things. Do your homework, have courage, and don't give up. You do that, and very little in life is impossible. And those are words I've lived by all these years, and I stayed in med school. And so I tell the medical students, I try to give them encouragement, and I say that America is such a great nation. No matter how the politicians try to mess it up, America eventually gets angry about it, and they will replace them, and we will get a system that works. So I say don't give up on America.